Hello, my name is Brian. I'm a student physical therapist at Franklin Pierce, and I'm just about finished up my affiliation at Nathaniel Witherall, a skilled nursing facility, and subacute rehab. And I wanted to share a little bit of my experience here. So, as a student physical therapist, I do a lot of evaluations, basically one-ish a day, either on the current residents there for like any new health issues that might have just came up, or for new admissions just to see how well they can functionally move and help them get back home, right? Or maybe send them off to an assisted living facility or long-term care, so on. And in order to prepare, I got to read their past medical history and medical records to kind of give me a good gauge on what their current base level of function would be. And if there's one thing I noticed is that a lot of them have, comorbidities of hyperlipidemia, hypertension, diabetes, and a lot of these patients, and indeed some of the patients that I've worked with, the diabetes has kind of came up as a bit of a hindrance to terms of them progressing with skilled physical therapy. I had this one patient, like towards the end of his stay, he kind of just like plateaued before leaving the place, but we weren't able to functionally gain too much out of him. And often he was loopy coming into PT, and that was because of his diabetes. He would come into physical therapy and he felt really out of it, just either would have signs of like either being hyperglycemic, low glycemic, like mouth dry, blurry vision, feeling weak. And there's only so much I can do in terms of helping him get better. I can't stand him up and have him do stairs if he can't even stand up straight because he's too dizzy and weak. So an idea that I had in the past, when working with him, is that like, why don't we just have our diabetic patients go on to a more low carb diet? Because if we go on a low carb diet, right, we don't really have to worry too much about blood sugar spikes. So we still need to like get our daily calorie intake in. So if we go low carb, how about we also go high fat in diet, right? So explanation of what goes on when like your average Joe is eating carbs is that our body just runs on glucose, right? And that's just a simple carb that we get from eating carbs. Breads, pasta, like that type of stuff. And even though it's easy to access, the glucose is kind of like running on like regular gas, if I was kind of related to a car, where the gas will go away pretty fast, and the fuel is not as efficient as running on fats is. So if we run on fats, our body starts to use ketones as fuel, and ketones is a more efficient source of fuel comparatively to glucose. So glucose, it's kind of like using regular gas in your car, and using ketones from eating a higher fat diet is kind of like running on jet fuel. You feel more energized longer, you feel full longer, and that's just because of the difference of calories. Every carbohydrate is 4 calories compared to every fat or lipid is going to be 9 calories. So fats have twice the amount of calories or energy as carbs do. Hence, we feel more less tired, I guess you could say, when you're on a fattier diet. So the big benefit here for our diabetes patients is when we're on a low carb, high fat diet, is that our pancreas is no longer being used as much, because our pancreas is the organ that secretes out insulin to lower our blood sugar for when it gets too high. But when you're a type 1 diabetic, you have no insulin to produce due to your own immunity attacking your islet cells. Eliminates that idea. And when you're a type 2 diabetic, your body becomes insulin resistant due to the insufficiency of insulin that it can produce. But when we're on fats, that doesn't really matter too much, because insulin is more associated with carb consumption. But when you're on fats, we're kind of just, acknowledging the compensation and having our body use a different source of fuel to help get through our day, right? So when you're looking at fats, I think people get a little bit apprehensive towards having a higher fatty diet because of the LDL, which is the cholesterol that our medical doctors typically tell us to watch out for. When a doctor tells you, oh, your cholesterol is way too high, they typically look at LDL and tell you that. they don't really look too much at HDL. That's more of considered like the good cholesterol overall. So they kind of just like let the one slide. But LDL, no, this is the end of everything. This is what the doctors have been relating to coronary artery disease, peripheral artery disease, strokes. It's basically the plaque that builds up in our arteries, and kind of puts us at a risk for a cardiovascular disease. And yes, that is the case, but it's also because a lot of these patients who have these issues are consuming carbs. And LDL, when you just look at the function alone, LDL just drops off cholesterol to the peripheral and liver cells to help with energy distribution, while your HDL is like the boat that carries the LDL away from the arteries and brings it to the liver so the liver can be broken down and passing through the body. LDL is not as bad if we don't consume carbs. So when we consume carbs, right, this little circle right here is a normal LDL cell, right? When we consume carbs, it oxidizes, gets damaged, and it starts shriveling up and shrinking and becomes little tinier particles respectively. And these little tinier particles is what actually is getting stuck on the arteries within your body. And that's the stuff that kind of puts you at risk for those cardiovascular diseases. However, if you eat high fats, your LDL levels, or the size of your LDL, actually starts to get bigger, right? And you think bigger is worse. Not necessarily. It gets bigger, it gets fluffier. And from getting bigger and fluffier, it actually reduces the chances of these particles getting dislodged into your vessels or arteries. So if you were to get your blood work done, but you're on a high saturated fat diet, your LDL levels might be high, but you got to also examine the integrity of your LDL particles. Because if it's small and shriveled, then yes, that's not going to be that healthy, and you got to watch out. But if you're truly running on a keto diet and you're in a ketotic state, then your LDL particles should be looking big and fluffy and not getting dislodged at all within your vessels. So with new research, this has kind of been how new research has been kind of combating like what we've known so far for common conceptions. So some common conceptions is that, as I said before, LDL is bad, HDL is good. But when if you eat a fattier diet, won't that just increase both the things to unhealthy levels? And it's like, not necessarily. So typically when you're on a higher dietary fat consumption, you actually lower your total and your LDL cholesterol despite you consuming way more fats. But if you decide to be on a more lower dietary fat consumption diet, you actually increase your total and your LDL cholesterol values up. And that is just because of the whole oxidizing and fluffy concept that I was just talking about before. So there's a lot of benefits to kind of go on with this. And when you look at terms of food options, I think it's fairly easy. It's similar to just eating the Mediterranean diet. So you want to just eat a lot of green vegetables, lettuce, spinach, include avocados as well. Get your fruits in. Berries are definitely the way to go around with that. And in terms of protein, you want to go for fattier meats. I wouldn't say pork too much, but I think fatty cuts of beef, like the ribeye steak, I think that's a pretty fair take to chop and mix in with salads to kind of get the rest of your greens in. Yeah, so if you kind of just keep doing that a bit, you should notice that we will have less hypoglycemic episodes with our patients if we can just change the way that they diet. I believe that will help them in terms of recovering, as there's like less hindrance on their whole road to recovery, respectively. That concludes my presentation. Thank you for listening.